Pain in the lower back, buttocks, and the back of the thigh, which worsens when sitting, standing, or walking, can occur due to issues with the piriformis muscle. A spasmed piriformis muscle compresses the sciatic nerve, as well as other vessels and nerves that pass through the greater sciatic foramen. As a result, pain can occur in the calf and foot. Swelling of the affected limb, sexual disorders, pain in the area of the external genitalia and in the rectum. In this video, we discussed exercises and helpful recommendations that will help relieve discomfort at your own home. I am Dr. Chernov. Enjoy the video. The piriformis muscle attaches at one end to the front surface of the sacrum and at the other end to the femur. It exits the pelvis through the greater sciatic foramen, where the sciatic nerve also passes. The upper gluteal vessels and nerve, the pudendal vessels and nerve, the inferior gluteal nerve, the posterior cutaneous nerve of the thigh, as well as the nerves that go to other nearby muscles. The shape and size of the piriformis muscle can vary among different people. In the overwhelming majority of cases, it is wide and massive, while in some, it is thin and small. When the piriformis muscle is massive and fills all the space of the greater sciatic foramen, it can compress the vessels and nerves. It negatively affects the innervation and blood supply, not only to the entire leg, but also to the buttock area and the front part of the perineum. Prolonged compression of the gluteal nerves and vessels can lead to atrophy of the gluteal muscles and a decrease in their volume. Involvement of the piriformis muscle by trigger points leads to pain primarily in the area of the sacroiliac joint, the buttocks, behind the hip joint, as well as in the upper part of the back of the thigh. Pain from nerve compression is different from myofascial pain that comes from trigger points. However, very often both of these conditions occur simultaneously. Pain from sciatic nerve compression can radiate further than pain from trigger points in the piriformis muscle, and it radiates to the lower leg, as well as to the sole of the foot. A tense piriformis muscle can often displace the sacroiliac joint and significantly contribute to pelvic tilt. Activation of trigger points in the piriformis muscle can occur as a result of any unusual loads. For example, when trying to prevent a fall. Deviations to the side when bending or rapid rotation of the leg can also cause acute overload. Muscles, prolonged sitting on a hard surface. Prolonged driving or direct trauma to the area of the gluteus maximus muscle can also trigger the activation of trigger points in the piriformis muscle, leading to characteristic pain. The pain worsens when getting up seated and walking. Exhausting sports activities such as running, playing soccer, basketball, or tennis can significantly overload the piriformis muscle. The Piriformis Syndrome can be accompanied by both pain and sensory disturbances. For example, a burning and tingling sensation in the lower back, in the groin, perineum, buttock, hip joint, along the back of the thigh, calf, and foot. In addition, swelling of the affected limb, sexual disorders, tenderness in the area of the external genitalia, and impotence in men may occur. It is commonly believed that three components contribute to the development of Piriformis syndrome. The first is myofascial pain originating from trigger points in the piriformis muscle. Second component is nerve and vessel compression in sciatic foramen. And the third is the displacement and dysfunction of the sacroiliac joint, when persistent tension in the muscle leads to the misalignment of the sacroiliac joint and joint dysfunction. It maintains prolonged tension in the piriformis muscle. In a seated position, a person with piriformis syndrome usually fidgets and often changes their posture. They may often have difficulty trying to cross the affected leg over the healthy one. In a lying position on the back, relaxed, one can see a persistent external rotation of the thigh on the affected leg. When trying to lift the straightened leg, there is a noticeable limitation in this ability slightly on the affected side. If you place your hands on the patient's knees and ask them to spread their legs, weakness will be noted on the affected side. Muscles, pain, and trembling in the leg. There are 4 variations of how parts of the sciatic nerve exit the pelvic cavity. In the first case, the sciatic nerve passes in front of the piriformis muscle, between the muscle and the edge of the greater sciatic notch. This is the most common variation, typically occurring in 85% of cases. In the second case, the fibular part of the sciatic nerve passes through the piriformis muscle, and the tibial part of the sciatic nerve is located in front of the muscle. Third variation, the fibular part of the sciatic nerve loops over the top, and then goes behind the piriformis muscle, while the tibial part of the sciatic nerve is located in front of the muscle. In 1% of cases, the sciatic nerve passes through the piriformis muscle. It is important to note that the most common initial variation often leads to the compression of the sciatic nerve. Compresses the sciatic nerve due to bony edges and ligaments exerting more pressure than muscle bundles. To eliminate trigger points in the piriformis muscle, relieve its spasm, and unblock the sciatic nerve, it's necessary to apply mechanical pressure to the muscle, followed by stretching it. Take a small massage ball or a tennis ball and lie down on the floor. Place it under the area of your buttock and apply pressure for a few minutes. Massage pressure on the gluteus maximus and the piriformis muscle lying underneath it. Move your pelvis, first to the right and left, then forward and backward, and then in a clockwise and counterclockwise direction. If there are trigger points in the piriformis muscle, you'll feel significant tenderness in that area. Find the most painful spot, stop and press on it for 30 seconds. For even more intense mechanical pressure on the piriformis muscle, place your leg on your knee, the second leg. Make sure to repeat this exercise on the other side. After that, stretch the piriformis muscle. Since the main function of the piriformis muscle is hip external rotation, you can stretch it using hip internal rotation. The simplest exercise is simply lying on your back. Bend the affected leg at the hip joint and place the foot on the knee of the straight leg. Grab the knee of the bent leg with the opposite hand and pull the leg towards the floor. Hold the final position for 1 to 3 minutes, maintaining deep and smooth breathing. This position, in addition to stretching the piriformis muscle, can be used for self-mobilization of the sacroiliac joint, which is characterized by a clicking sound. After stretching the muscle, it's important to perform a few active movements that engage the piriformis muscle. Repeat the exercise on the other leg. For an even more intense piriformis stretch, place the shin of one leg near the knee of the opposite leg, bend your leg and wrap your hands around your thigh. Gently bring your legs closer to your torso and feel the stretch in the muscles. Hold the final position for a few minutes and then repeat the exercise on the other leg. A more complex but very effective exercise for stretching both piriformis muscles is the following. Bend one leg at a 90-degree angle at the knee and place the second leg on top. Try to bring your legs closer together while keeping your back straight. You need to be very careful with the load to avoid injuring your knee joints. After holding the final position for a few minutes, switch legs and repeat the exercise on the other side. With piriformis syndrome and sciatic nerve compression, you can perform these exercises in isolation, but it's best to do a set of exercises, the link to which you will find in the description of this video. To eliminate long-standing harmful factors that cause the formation of trigger points in the piriformis muscle, you should follow these recommendations. It is necessary to eliminate functional scoliosis caused by unequal leg lengths or a reduction in the size of one half of the pelvis. Avoid prolonged static loads. For example, when sleeping on your side, it's important to place a pillow between your legs to avoid prolonged stretching of the piriformis muscle. When sitting in a car seat or at a computer, it's important to pay attention to your posture. Don't throw one leg over the other and don't sit on one leg. Take frequent breaks at work by doing self-massage of the piriformis area, stretching exercises, or just a short walk. When exercising, don't overload the muscles in the gluteal area. It's important to note that piriformis muscle damage rarely presents as an isolated syndrome. Very often, the pathological process involves 5 other short muscles that perform external rotation of the hip, as well as the gluteus maximus, gluteus medius, and gluteus minimus. You can find detailed reviews of these and other muscles in this playlist. I would be happy if you share this video with your friends who suffer from issues with the piriformis muscle and sciatic nerve compression. Stay healthy and see you in the next videos.